Hello, my name's Carol. I'm the cytology lead for BLMK. I just want to talk to you today about coming for your first smear appointment and what will happen. It's a national screening programme where females between the age of 24.5 and 65 are invited for a 3-yearly screening to reduce the risk of cervical cancer. Most ladies screened have a negative result, which means that everything is as it should be and they're invited back for screening every 3 years. The screening process will check for abnormal cells in the cervix. If your result is abnormal, you will receive a letter telling you what treatment or monitoring might be required. We are testing for human papillomavirus, which is also known as HPV. HPV is a common virus which lots of people get. It is a virus which we all have, but it sometimes activates. It doesn't mean that you do have cancer. The lab will check the cells to see if treatment or monitoring is needed. If they decided to monitor, you will most likely be monitored yearly until you have a negative test result. Whether you're sexually active or not, it is still important to have your smear test. It can be embarrassing and no one likes to get undressed in front of a stranger. It's also about privacy and exposing ourselves to a total stranger and trusting them to keep you safe. At your first appointment, you will have time to ask questions. There will be questions and information the nurse will want before the procedure. So, before coming for your appointment, write down the first day of your last period. It is useful to know this so the lab can see where you are in your cycle, as this does affect the presentation of your hormones. Tell us at your appointment if you're on any hormone replacement therapy or contraception such as pills and coils, implants, as they influence your hormones as well. So let me show you what we use for collecting the sample and how they work. So we have 2 sizes usually of speculums, a medium and small. The nurse will decide which size would work best for you at the appointment, depending on your presentation. Sometimes it's more comfortable to use a small speculum, especially if it's your first smear. For some people, it's easier to view the cervix if we use a larger speculum. So just to show you, it is a plastic speculum. It's got nice soft sides, so it shouldn't scrape, shouldn't feel painful or cause you any damage. However, if you find that it is uncomfortable or you have any discomfort or pain, ask your nurse just to stop for a little while. They can take the speculum out, discuss with her whether you feel comfortable to continue or whether there needs to be some adjustment of the speculum so that you feel comfortable and more relaxed. It does make taking the sample easier. So with the speculum, we pop it into your vagina so that we can then twist it, open it gently, so we can just see down the centre here of where your cervix is. So then we would lock it in place and using a brush, we would insert that this way through so that we can take a sample of your cervix and then take that out and bring the speculum out gently. So the brush that we use has soft bristles, shouldn't scratch, scrape or cause you damage. You may feel it moving or you may not, but it is designed so that it softly brushes and you shouldn't have any trauma from it. So this is what the clinic room will look like that you come into to have your smear done. All clinic rooms are slightly different. This one's a nice, large, really airy clinic room. Some are much smaller. However, the setup will be similar. You'll have a bed which we will be asked to lay on with your head on the pillow so you're nice and comfortable, and a blanket that goes over the middle part of you to keep your privacy. So there'll be a screen that either like this one will go round the bed, or they may have a curtain that comes from a rail on the ceiling that will come round the bed to keep everything private and keep it just between you and the nurse and the companion if you bring a companion with you. So most of the equipment in most rooms will be on a trolley so that it's easy to use. The bed will be raised up so that it's a comfortable level for the nurse. And there's a lamp, and the lamp is on. It will shine under your blanket just so that it gives us more light so we can visualise everything as we're doing the procedure. So the key to taking the sample is the more relaxed you are, the quicker and easier it is to take the sample. We realise that that's easier said than done. Even I get nervous when I go for a doctor's appointment, so coming for a first smear is a very big event. The experience should be a positive one, as we would like all ladies to continue with their screening until they're 65. If you're feeling nervous, ask the surgery if the nurse or one of the nurses can give you a call to talk through any concerns with you. If you don't want to come to the appointment on your own, bring a friend, mum, or somebody that you feel comfortable with. The person that you bring can either stand by the side of you, hold your hand, or be the other side of the screen. It is your choice so that you are comfortable during the appointment. We want you to have a positive experience. We're all embarrassed about our bodies. Getting undressed in front of a stranger isn't easy. When you get the invite, book your appointment. If you want to speak to somebody before you book your appointment, contact the surgery by telephone and ask the nurse if they can call you back as you have some questions before your smear appointment. I hope this gives you some idea of what happens at your first smear test, and we look forward to seeing you.